So, in all studies in advanced liver cancer, we're always trying to balance efficacy versus safety. 90% of our patients with liver cancer have underlying liver disease, and that carries with it certain comorbidities that puts them at risk for increased toxicity as compared to someone who doesn't have liver disease. By design, our studies in advanced liver cancer have concentrated on a Child-Pugh A population to minimize the risk of death or events from underlying liver disease and not malignancy. So, in that regard, IMbrave150 concentrated on Child-Pugh A patients, and also because of concerns about bevacizumab's bleeding risk, all patients were required to have an upper endoscopy within 6 months before coming on study. And what we saw in the study, and even at the updated analysis, which was very consistent with the primary analysis, so now with longer follow-up, we see that the combination is generally very well tolerated. The general all-cause adverse events was very similar between both arms. Treatment-related adverse events was actually a little higher in sorafenib, 95% versus 86%. We do see more grade 3-4 adverse events with atezo-bev, but if you look at treatment-related adverse events, they're very similar. So when we're talking about adverse events, those that are most common with atezo-bev really seem to be related to the bevacizumab component, being hypertension and proteinuria, things we know about. Fatigue has been common with the regimen, but not too dissimilar than sorafenib. In fact, when we look at quality of life readouts, quality of life is markedly improved with atezo-bev as compared to sorafenib, because we don't see high frequency or high grade diarrhea or hand-foot skin syndrome. We do need to be cognizant that there are the risk of adverse events, immune-related adverse events, but again, no new safety signals as compared to other diseases. Certainly we need to watch liver function because there is a risk for drug-induced hepatitis or autoimmune hepatitis, but that is fairly uncommon. There is an increased risk of bleeding with atezo-bev as compared to sorafenib, but generally that's lower grade bleeding like epistaxis. And there were a few, about 1% grade 5 events related to bleeding. Not all of these were clearly related to bevacizumab, but again, I think in the overall context of the safety versus efficacy profile, many of us are very convinced that this is probably the new standard of care in properly selected patients.